Fanconi syndrome is a rare disorder of the kidney's proximal tubules leading to improper reabsorption of electrolytes and nutrients. This results in the excessive loss of essential substances in the urine, such as glucose, amino acids, phosphate, bicarbonate, and other electrolytes. Let us now discuss the causes of Fanconi syndromes, which are of two types. One is the inherited causes and the other is acquired causes. Let us first discuss the inherited causes, which contain genetic disorders. So, Fanconi syndrome is often associated with inherited conditions like cystinosis, Wilson disease, and hereditary fructose intolerance. The other is inborn errors of metabolism, affecting how the body processes certain nutrients or substances. And now let us discuss the acquired causes, which contains number one, medications and toxins. So certain drugs, especially ifosfamide, outdated tetracyclines, and antiretroviral medications can induce Fanconi syndrome. The use of heavy metals, such as the exposure to toxic substances like lead, cadmium, or mercury. And the third is multiple myeloma, which is a type of cancer affecting plasma cells, which can disrupt kidney function and cause Fanconi-like symptoms. And the last of the acquired causes is kidney transplants. So chronic rejection or other complications can also result in proximal tubule dysfunction. Let us now discuss the symptoms of Fanconi syndrome. So the symptoms of Fanconi syndrome are due to the loss of substances that are normally reabsorbed by the kidneys, leading to a variety of issues including polyuria, which is excessive urination, polydipsia, which is excessive thirst, dehydration, hypophosphatemia, metabolic acidosis, hypokalemia, rickets in children, or osteomalacia in adults due to phosphate loss. Now let us discuss the diagnosis of Fanconi syndrome, which include urine test, blood test, and imaging techniques. Urine tests show elevated levels of glucose without diabetes, phosphate, amino acids, and bicarbonate. Blood test can indicate metabolic acidosis, hypophosphatemia, and electrolyte imbalances. Lastly, bone X-rays may reveal rickets or osteomalacia in affected individuals. Now I'm going to discuss the treatment options for Fanconi syndrome. So the number one option is correcting electrolyte imbalance, which includes phosphate supplements and vitamin D to manage bone health, bicarbonate or citrate for metabolic acidosis, potassium and magnesium supplements to address deficiencies. The second option we have is treating the underlying cause, which is the discontinuing any offending drugs or toxins, managing underlying diseases such as cystinosis or multiple myeloma. And the third option is dietary adjustment, a nutrient-rich diet, especially focusing on electrolyte replacement and bone health. So if we summarize this whole video, then Fanconi syndrome is a disorder of the kidney's ability to reabsorb essential substances, leading to various symptoms. Treatment focuses on correcting the losses and addressing the underlying cause. So dear viewers, that was all about Fanconi syndrome. I hope you find this video informative. Keep sharing, liking, and subscribe to our channel Pharmacy D by Asim. Also, the link to our various social media platforms is given down below in the description. Go follow us there as well. Thank you.